Amanda Rogers from Complete Care Animal Hospital, and today we're going to talk about insulin, how to handle it, and how to give your dog an injection properly. We'll have a separate video for cats as well, but the same principles apply for dogs and for cats as far as insulin goes. So certainly if you're talking about giving insulin to your pet, it's because they've been diagnosed as a diabetic. So it's very important to make sure you follow your veterinarian's recommendations about how much insulin to give and when. Please do not try to change insulin dosing around yourself or to make changes to it. It's very important that you do this under the guidance of your veterinarian who knows your pet's condition and knows exactly what that pet needs. So there's two types of insulin available. There's U100 insulin, which is what human insulins are, and many of our dog patients are on human insulin. And there's also U40 insulin, and U40 insulin is specific veterinary insulin. Basically, the U40 versus U100, all that means is how many units per ml of insulin there are. It's very important to know that because it's very important to know which insulin you're giving and more importantly, which syringes you're using. You cannot use them interchangeably. So if you have a U40 insulin, we cannot be using a U100 syringe or vice versa. So make sure that you understand what insulin you're giving and that you are checking your bottle of insulin against the syringes that you're using to make sure that we don't have any accidents. Unfortunately, I have seen pet owners where they get syringes from a friend or a family member, or if they're using U40 insulin, they go to Walmart or some other place to buy syringes and then they get themselves in trouble. So it's going to be very important that you're paying attention to the proper one that you're using. So please do not reuse needles or syringes. It doesn't save you money, and there's the potential that you're introducing bacteria into your new bottle every time you use it. So please be responsible, making sure that we're using a new needle and syringe every time we give our pet an injection. The other thing is to make sure that we're disposing of those properly. We want to make sure that we have appropriate vesicle. A lot of veterinary offices will take those back like we talked about. Sometimes, it may just be buying some sharps containers or other things. So want to make sure that we're storing those properly so that we don't have any problems. So we're going to go over the different, again, let me show you how to spot the U100 versus U40 on your syringes and on your medication, as well as how to handle that. So most insulins are refrigerated, and that helps to contain their stability and helps extend their shelf life. If you accidentally leave the insulin bottle out on the counter for a couple hours or even overnight, it's not ruined. Here's the couple things though. It cannot be frozen. So if you accidentally freeze your bottle of insulin, it's no good and you need to get a new one. If you accidentally leave your insulin bottle in the car and it's July and 90 degrees, probably not going to be any good, so we're going to need to get a new one. But room temperature insulin is not going to immediately go bad. So thankfully, there's quite a bit of stability there. But again, if it freezes, it's bad. If it gets up over 100 degrees, it's not going to work well long term. So again, double check with your pharmacist or double check with your veterinarian. If you've handled insulin outside of that realm and you're not really sure what to do, just double check and we can make sure. Like we discussed, it's very important to know the type of insulin that you have and if it's either a U100 or a U40, and then also the type of needle you have is a U100 and U40, and that it corresponds to what you're using. So you can tell here, this is a package of insulin, and this is going to tell you it's a U100 insulin syringe. So it's very easy to look on here. It's also going to give you some more information about how many units are here, your expiration date, all that kind of stuff. But again, we're looking for the U100 versus this is the package here, and then it clearly shows here that this is a U40 insulin. So we want to make sure that we're using the right one. This happens to be a bottle of generic insulin that we've got for our patient here. And again, this is going to say right here, it's 100 units per ml. Again, human insulin is almost always going to be the 100 units per ml. The prescription canine insulin like Prozinc and other things, those are 40 units. So it's important that we use the right syringe. So for this insulin, we need to use these set of syringes and needles. So always make sure, like I said, we're using a new one every time. So we're gonna open this up here. We've always got our little safety cap on here, and that tells us that this is the first time that this is being used. So we're gonna take that off. So we're ready to go. And then we're going to get our insulin out. We do not shake insulin to mix it up. We're going to roll it. So it's going to be nice and important that we just roll it back and forth here gently. We don't want to introduce air bubbles. Now again, this is with the the Novolin and the human insulin. So we're gonna roll, make sure we reconstituted it. So we're going to get our insulin. So we're gonna stick right here in the middle of the stopper, and I usually will pull back beyond what I need. So we're just gonna pull up 10 units of insulin today. So as you can see that there's a little bit of bubble in there. So I like to pull up more than the 10 so that then I can push that air bubble out, and it usually will rise to the top. Now, I couldn't push it out quite there, but there we go. So you move it around a little bit. We want to make sure that the stopper goes to 10 so we can see what we get. Let's just say we had another air bubble in it. No big deal. Pull back, push it back in. We can move this around to get the appropriate amount. I think sometimes people get frustrated. They're like, but these are very small amounts. So we want to make sure that we're using the right amount every time. So we don't want one of those pesky air bubbles in there. So there's our 10 units. So we're happy with that. So we're going to pull this out and then we're ready to go. I've got the amount of insulin I want. I can put my bottle back, and then I usually have it so that my patient is ready to give right away. Now, if you want to pull it up ahead of time because you need to go get the dog or cat or whatever, then you can certainly recap it, but you have to be careful when you do that for a couple of reasons. One, whenever you recap a needle, you run the risk of putting that needle into your finger. That will hurt, and certainly we don't want to do that. The other thing is if you run the cap into the end of the needle, you're going to dull that. So you need to be really careful if you're going to try to recap something, and that's why I don't really recommend that we do it. I try to have the patient ready to roll, and we just give the injection. Once we give the injection, then again, you can take the entire needle and syringe, because these do not come apart, and just put that in whatever sharps container you're going to use. Again, sometimes I will have owners, they'll use milk cartons or things, and then they bring the sharps container for us and we dispose of it for them, or the regular red sharps containers that you can buy that can be properly sealed and disposed of. So we'll show you those here in a couple minutes, but now we've got our insulin ready to go so we can give it to our patient. Okay, so now we're going to show how to actually give the insulin injection. Like we talked about before, Felix is not actually diabetic, but he's a great little model, so we're going to give him a saline injection. So it's important. I like to do it either, if we're going to give the injection either on the floor or on a table, whatever works best for you and whatever your patient is comfortable with. As you can see, Felix is not in any distress or anything about going to get this injection. So the best place to give the injection is right on the back of the neck. There's a lot of extra skin and a lot of extra area there for us to be able to give it. So we want to make sure that we have our insulin drawn up and we're ready to go. Again, I usually will take it straight from the bottle and give it straight into the patient. Okay, so we're going to make this nice little tent here, this little V, where we can put the insulin right there, and so it makes it nice. It keeps your fingers away from it. We take our needle and we're going to push straight in. Always aspirate back. We want to check to see if there's any blood here. That would mean that we were in a blood vessel. We're not, so then we're going to push it all at once and then pull straight out. So you can see that didn't bother him at all. It wasn't uncomfortable. And then we now know he has his insulin. We can safely dispose of our syringe. Felix and I want to thank you for watching and hope that these videos were helpful for you to help manage your pet's diabetes at home. Certainly, again, you want to do that under the discretion of your veterinarian, but being able to properly administer the injections and check your pet's blood glucose or blood sugar levels are going to be very important to making sure that we're managing them properly and getting them the best possible care that they need. So certainly if you have any questions, always make sure you're following up with your veterinarian and that these things are helpful for what you need to do. And certainly if you like what you saw, give us a like or hit the subscribe button. We're happy to have you on our channel. And thanks, Felix, for being such a good boy as always.